An 8-year-old boy is brought to the office due to fatigue and intermittent bone pain for the last year. The patient's parents are concerned because he has stopped playing outside and mostly stays indoors watching television. On examination, height and weight are the 5th percentile. Yeah, this is really risky. Abdomen is soft and non-tender with the liver palpable. That is, there is hepatomegaly along with splenomegaly also, because spleen is also palpable. Below the left costal margin, lab results show anemia and thrombocytopenia. A bone marrow biopsy shows macrophages with wrinkled paper-like cytoplasm due to the accumulation of glycolipids within lysosomes. Yeah, glycogen storage diseases it is. The patient prescribed enzyme replacement therapy. Which of the following sets of pharmacological properties best characterizes the administered medication? If all of you guessed Gaucher's disease, full marks to all of you because it is a glycogen storage disease, which is an autosomal recessive condition caused due to the deficiency of the lysosomal beta glucocerebrosidase. This is from biochemistry, but therapy will be done in pharmacology way. So that is the best part about USM, that is a test everything, and next exam will also be like it, that like this only. So this deficiency leads to the accumulation of glucocerebroside. If there is deficiency of lysosomal beta glucocerebroside, glucocerebroside glucocerebroside increases, which is a glycolipid component of the cell membrane within the lysosomes of macrophages, giving them the classic appearance of wrinkled tissue paper. Wrinkled tissue paper. Characteristic symptoms: hepatosplenomegaly, pancytopenia, bone pain develop as lipid-laden macrophages accumulate in the body's tissues, namely the spleen, the liver, and bone. Lysosomal storage diseases can be treated through the delivery of replacement enzyme into the lysosomes of affected cells. In the case of Gaucher disease, we use recombinant glucocerebrosidases, which we use Imiglucerase, which are available to replace the deficient enzyme. So now let us have a look at the options, the route, entry, and the structure. First of all, first things first. Certain lysosomal storage including Gaucher disease, they can be treated with enzyme replacement therapy. I told you, recombinant. But because enzymes are large proteins, extremely important point, they are large proteins. Okay, they are large proteins, number one. Number two, they cannot be absorbed by the oral route because they are large protein, so cannot be absorbed by the oral route. Fine. It must be administered by the intravenous route. So these options go for a toss. First, oral is only wrong, then we don't go ahead, right? That is the way to tackle such questions in NEET, PG, NEXT, and USMLE and PLAB also. So entry into the cell occurs by endocytosis after the replacement enzyme binds to mannose. So entry occurs by endocytosis. They are large proteins. So answer is undoubtedly A. Clear? After replacement enzyme binds to mannose, yeah, you know it, okay, you know it, but I'll just be repeating it. Mannose 6-phosphate. Enzyme binds to mannose 6-phosphate receptors which are present on the cell surface. Now all of us know the answer, right? It is A. But now what we will look across is every option, because every option is a question in itself. So here you have 7 questions. Okay. Choice B. All human enzymes including lysosomes are large polypeptides. Although the oral route is often preferred from drug administration, okay, most peptide based drugs. What are the peptide based drugs? Yes, very good. If you answered insulin and immunoglobulins, excellent answer. They cannot be efficiently absorbed by the GIT due to intestinal epithelial barrier and extensive proteolysis. That is why we have insulin pumps. Subcutaneous insulin injection, insulin pumps we have. Large polypeptides such as glucocerebrosidases have to be administered intravenously. Okay. Once in the circulation, exogenous, what happens? Basically, you need to first understand what happens. Exogenous glucocerebrosidase, lysosomal glucose, can enter cells by binding to mannose 6-phosphate receptors, which I told you, which are present in the Golgi network, Golgi apparatus, which help route newly synthesized lysosomal proteins stacked by mannose 6-phosphate residues. They are also expressed on the cell surface where they bind free lysosomal enzymes that are accidentally secreted. Exogenous glucocerebrosidase can bind to these cell surface receptors, inducing endocytosis of the bound enzymes. It is then carried by endosomes to lysosomes. Carried by endosomes to lysosomes, where it degrades glucocerebrosides, reducing disease manifestations. Everything was inside the lysosome. So here it degrades, destroys glucocerebrosides, reducing the disease manifestations. Fine. So here the structure cannot be steroid, it has to be protein, which I told you. Then choices C and D. Intravenous passive diffusion. See, enzymes, I told you, they are large polar polypeptides. They are large polar polypeptides that are unable to effectively cross the cell membrane by passive diffusion. Here a very important pharmacology concept which I have acquired from my knowledge of 13 years is passive diffusion is the most common route of any administered drug. This is also asked as an MCQ in your NEET PG, PLAB, USMLE. Most common route of absorption of drugs is passive diffusion, but here it is not. Why? Because they are large polar molecules, large. That's why. Steroid is obviously out of the question. Why? Yes, you know the reason. And if you are right, if you said hydrophobic, full marks to you. Boy or girl, full marks you deserve. Because steroid is hydrophobic. And they can easily cross cell membranes by passive. However, they function by binding to receptors. They do not catalyze reactions. Steroids do not catalyze reactions. This is extremely important. Steroids do not directly catalyze reactions. Okay, they do not catalyze reactions. Then, unlike in lysosomal storage disease, enzyme replacement for pancreatic exocrine insufficiency is administered orally because pancreatic digestive enzymes normally function within the gastrointestinal lumen. Okay, bye.